Now. Hello, everyone. Welcome to Open Heart Discussions. I'm Lacey Fisher, the owner of Open Heart Counseling ATX, and today I'm excited to have Dr. Kristin Lasseter here with us to talk about her work in her clinic, which I know she'll tell us all about the Reproductive Psychiatric Clinic of Boston. I would love to hear more about just your professional journey, where you started and where you are now. So just go ahead, take that over. Let us know about yourself.
Sure. Well, thank you so much for inviting me to come talk with you. This is awesome. Um, Psychiatry was like the last thing I thought I was going to do when I was doing medical school. I went to medical school thinking I was going to do OB-GYN and was really, excited about women's health. And then as I went into my third year rotations and started going through all the different specialties, I realized that um, OB-GYNs work really hard, and it was not maybe the lifestyle that I had thought that I wanted. And then I went and did my psychiatry rotation at the very end because I thought there's no way I'm doing psychiatry. And I absolutely loved it. I thought the information was just fascinating, and all the medication and the way that just the brain works was like I couldn't stop studying it, which was weird. Um, and then when I was doing my psychiatry residency rotations or my psychiatry residency interviews, I learned about women's mental health, which we didn't really have where I was training or when I was in med school in San Antonio. And so it was really exciting to learn about this field and to try and bring it to Texas. And luckily there was a woman in Houston named Dr. Lucy Purrier, who's done a lot of work in women's mental health in Houston. But we just didn't really have much of that here in Central Texas.
Okay, so that's how your journey started, and you got to where you are today. And I heard you talk, a little bit about women's health in there. So can you expand on that and tell us, is that what you're really passionate about? It sounds like. Tell us more about.
Yes. Yeah, I've just always been fascinated with women's health, and particularly reproductive hormones and kind of how all of that works. And so I just thought that that's what I wanted to do. And I love the patient population that I get to work with. And that's kind of was the big driver too, is being able to be there for women when they're, going through really big life changes.
Okay. And are there some topics within that you feel are not discussed, that we as a whole just kind of ignore? If there are, what are some of those topics that you feel should be discussed more?
Yeah, that's a great question. I feel like the biggest thing is everybody kind of glosses or makes motherhood and pregnancy look like this picturesque type thing, and it's not for most people. I think that there are some people who have just a great experience and it's all rainbows and butterflies, but for the majority of people it's a lot of mixed emotions, and that's more of what the norm is. And I just wish that people showed that side more. That way so many women don't feel, isolated, or like they're the only ones having, these bad feelings and then feel guilty for these thoughts and these feelings, and are absolutely normal. That's one of my biggest pet peeves, especially with social media. It drives me nuts.
Yeah, absolutely. Everything looks picture perfect, and a lot of people, I'm sure you hear this and I hear it as well, is like, I must be doing something wrong because everyone else seems to be doing all of these tasks and not having a problem with it. And I want to tell you, people are putting their best on social media.
Yeah.
That they're probably struggling with a lot of the same things you are.
Yeah. Or even when, friends or acquaintances talk to you, sometimes they're not opening up about everything that's really going on, because that's a lot more vulnerable and scary for them too.
Why do you think that is so scary? That even friends, that people you're close to, might still even be like, "Oh, I can't talk about that, what I'm going through."
I think it has to do with people just feeling like having anything negative or negative thoughts or these really normal emotions are somehow weak or means they're not doing something right. And I think that they don't want to show that side because that looks weak. And when we're weak and vulnerable, that's when we can get attacked or, people can take
Yeah.
advantage of us. And so a lot of times people are just scared to open up that side of them to others.
Okay. So, so in your work, and this, I think we're going to probably go a couple different directions with it, is why mental health is so important in your work, especially when I think about, we've been talking about stigmas, and there's a huge stigma around mental health in general when it comes to perinatal mental health, and then about medications. So I know I just kind of threw a lot at you, and I just want to let you talk and let you go where you will with it. Um,
Yeah, I mean, I think, um, I was thinking about this earlier this week. People focus so much on medication when they're kind of talking about mental illness, and it's like the medication is the scary thing, and we don't want to have to take medication, and I'll do everything I can to, keep my baby safe and not have to put that in my body. But I think we forget about how detrimental mental illness is on women's health. In women who are pregnant, having symptoms of depression and anxiety have so many negative effects on the pregnancy, just on the woman's health herself, but then also on the fetal development. And so recognizing that mental illness is not this benign thing, that it in itself is very risky for a pregnancy and for a baby, um, I think is more important to focus on that than to focus on, what are all the risks of these medications, and seeing these medications in a bad light. In this ideal world, we wouldn't have mental illness or medication, and we could just be, natural and happy and whatever. But unfortunately, that's not the case for a lot of people. I think it's like 25% of people suffer with mental illness. And that doesn't mean that you're doing anything wrong or you're not trying hard enough to fix your thoughts or something. It just means that your brain is suffering from an illness at that time, and it needs medication, just like when you have high blood pressure or diabetes or
yeah.
whatever other illness might come up. It's better to treat it with medication than to let the illness get worse and let your body suffer.
Right. And in your practice, specifically your work, you do medication management and therapeutic work as well, correct?
Hmm.
Yeah. So can you talk to us about how that might be a little different than some services that people are used to with the psychiatric just medication management?
um, i think that I think that both are fine. I just feel like for my patients, a lot of time when I get to spend more time with them, especially in the beginning as we're getting to know each other, it's really helpful for me to kind of understand what are the other layers that are going on, because medication isn't the only answer. Just like any other treatment, it often takes multiple types of modalities to help someone get better, and exercising, therapy, diet, all these things that are good for our bodies are also good for our brain. And so really being able to help understand, what are all the layers that are going into this, and how can we help them in other ways other than just medication.
Oh, great, great. How does your work impact, or what do you notice around the BIPOC community or the LGBTQ community?
So I really try and be inclusive in all communities. So I'm half Chinese, and growing up in Texas, it was, I thought I was like the odd person out. And so being able to just recognize that, hey, there are these other groups of people out there who aren't in the limelight, who maybe are suffering in silence or feeling like they can't say anything. Being able to reach out to them and make them feel safe is important to me. Just because I feel like, so many people just, I don't know, just kind of they aren't able to see things from somebody else's perspective or somebody else's experience, which is completely normal. But I think it is important to at least try and to recognize when culture and differences play a role in our healthcare and how we can address that.
Yeah, absolutely. So all of us at all of our time doing our work, I think it's something that, when I ask that question, it's probably something I say over and over in these interviews that I'm doing is that, and everyone agrees that it's a lot of your own awareness, your own work, and recognizing the importance of multiple cultures and seeing what that means for that person.
Yeah, trying to understand, how were they raised to think about mental health, or what do
Yeah.
they think is going on? What do they think is contributing to the way that they're feeling? You can't help somebody just by telling them what to do. You have to understand kind of their views on it also.
Yeah, that's a great point. Thanks. Thanks for bringing that up. Thanks for saying that.
Mhm.
If you had a chance to let other professionals in your field know something, if like this message that you had to give them, what would that message be?
Don't tell your patients to stop their medication when they get pregnant.
Thank
It's
you.
my
Thank you.
biggest pet peeve. Yeah,
Yes.
because
Yeah.
what ends up happening is they come to me and they're like, my doctor told me these medications weren't safe to take in pregnancy, so I stopped. And then I got, of course, depressed or anxious again, or I got worse again. And then we have to spend all this time of the pregnancy getting them back to feeling healthy again. And most of the time, when somebody is sick, when they're suffering from depression or anxiety, it takes more than one medication to get them better. And whereas when they are finally better, usually you can get, just one or two meds and kind of keep them in this maintenance phase of feeling well. Um, but now you're exposing the baby to all these other medications plus to the illness, when if they just would have stayed on that medication to begin with, it would have been a lot safer for
Yeah.
them and for their baby.
I'm so glad you said that because that's one thing, of course, with the work that I specialize in perinatal mental health as well. And I hear that as, oh, I'm getting pregnant and I think my doctor wants me to go off my medicine. And I'm like, well, I'm not a doctor, but let me tell you what other doctors that I know who specialize in this as well would say. And
Yeah.
you to have that conversation with your provider, because it is going to be more beneficial for you to be mentally healthy, for you to feel like you're at the best you can be to get through this pregnancy and postpartum, with which both are such delicate times. So
Yeah.
I think that is an important thing to hear, and that's reassuring for, I think, other mental health therapists hearing this as well, is to say, go back and have that conversation. Or if you feel like you want to stay on, let's try to find your provider who does specialize in reproductive mental health or psychiatry.
Mhm. Yeah, for sure. And, I feel like it's getting more popular too. And so I feel like there are more people out there who have an understanding and education about this particular field, which unfortunately, when we're doing residency training for psychiatry and when OB-GYNs are doing residency training, they don't get, neither one of them get trained on this field. And so it kind of ends up being this gap in our education. So a lot of people kind of don't feel comfortable with using these medications in pregnancy, when in reality they're not as scary as the illness. And there's a website that I really love that I usually refer a lot of people to. It's called womensmentalhealth.org, and they have a lot of information on medications in general in pregnancy, but also just educating on, it needs to be a conversation. It's not just a blanket statement of you should stop or you shouldn't. It's really diving into all the reasons why we need to be having more in-depth conversations about this.
And I think that's probably, well, you let me know one of the reasons behind you creating what you did and the work, your clinic here in Austin. Can you please tell us about that? And I mean, just how much it's growing right now.
Yes. Well, my husband worked in Austin when I graduated from med school. And so I joke with him that like I was forced to come here for residency, and they didn't have any kind of women's mental health training where I went. So I had to go to Houston to get trained on it. And then when I came back, I was like, I'm going to start a women's mental health clinic. Like, this is going to happen here in Central Texas. Like, this is absurd that in Austin we don't have that. So yeah, I started this clinic, and I'm so grateful that my residency program also, understood how important this was to me, but also as a service to have for people here in Austin. And so they've also started a women's mental health clinic that serves, a lot of different people in terms of they take a lot of different insurances, and they try and do a lot of group work too. So it's been so exciting to see this area develop in Austin, specifically with psychiatry, because I think there were a lot of women here, or a lot of providers here who specialized in, not a lot, but a good number who specialized in therapy around this, which is just awesome. And I think we have so many good resources here. But with psychiatry, it's still pretty limited. And so I'm hoping that we can kind of change that soon.
Yeah, and your clinic, it started with you, and then you brought on another prescribing provider, and then you now have therapists that are there as well. So I mean, your clinic is growing, and that's, I know, like you said, exciting for this area to have something like that. So in a minute, I'm going to give you a chance to talk about where people can contact you or for other services there as well. So on the flip side, what would you like clients to know, or patients in this area? What is the message you would want to send them?
I, there's just so many messages. I think the biggest thing, the most important thing to me is just for people to feel comfortable in what they're going through. And when you're going through mental illness, obviously that's not a comfortable time, but to be able to be gentle with yourself, and you're already going through something that's so hard, and then to attack yourself for going through that, or being judgmental on yourself. It's just, I feel like part of the healing process is accepting what's going on, and being kind to yourself through the process. And that's something that I just wish more people would focus on when they're going through mental illness, especially around pregnancy and postpartum, when life is already really hard, and in a pandemic when when everything's just, it's not easy right now. And so at least being a support to yourself, I think, is really important.
Great message. Are there any resources that you would recommend for people who are looking for not just services, but support in general, other resources, ideas? What would you recommend?
So womensmentalhealth.org is a really good website resource, because we all know there's lots of things out there on Google. And so knowing what's actually validated and based on evidence and facts versus what's, just somebody's opinion, I think is important. As far as Austin resources, so we have PPHA, which Lacey and I are both involved in, but the Pregnancy and Postpartum Health Alliance of Texas. And it's just, I feel like, such an amazing organization that is, we're so lucky to have, because they don't have that in every city. And so it's a great place to be able to find providers who have been vetted in terms of therapy and doula and psychiatrists, and understanding more. They have a lot of educational stuff on their website too, but they also are just a great resource for resources. And so contacting them and saying, hey, this is what I'm going through. Like, what are my options in Austin? I feel like Melissa Bentley always has every resource out there, and
Yes.
it's an awesome thing to be able to be a part of.
Yeah, and their voucher program for people who were needing assistance that maybe couldn't afford those services. There is therapy voucher, psychiatric voucher. The doula program, we do have that. It's on hold right now with COVID, but that's always a resource as well, an option. So that program, we're, like you said, we're so lucky to have it. I think we've had people from other parts of Central Texas and even Portland reach out and say, we want to mimic something like PPHA. Please tell us what to do. How did you get these things going?
Mm-hmm.
Yes, we are lucky to have it. And I know Kristin and I both love being on that board, being a part of that. So
yeah,
special resource for us as well as everyone out there. So how do people get in contact with you or at your clinic?
So the most common way I feel like is just calling. We have two really awesome women who kind of woman the phones, Julie and Melody. And so they both love taking care of our patients and talking to them. And so yeah, calling our office is probably the best way to get in touch with us. And then I'm also on Instagram, of course. And my handle is the.reproductive.psychiatrist. And then we also have a Instagram page for our clinic that shares a lot of just kind of different educational things mostly. So those are probably the easiest ways to get in touch.
Yeah, and those are so important just for someone who, I mean, you may not be at the point where you're needing psychiatric or therapeutic services, but just being able to read information about it, to know that what you're going through is a thing. There are other people going through it. Like, that's why there's a whole field and people who specialize in it around that. So that can sometimes just be enough.
Yeah.
Even getting in a good peer support group will be what you need. So, well, is there anything that we haven't covered that you would like to go over?
I don't think so. I think we've covered a lot of stuff, and I'm really excited that this will be out there and that people can kind of know more about reproductive psychiatry and also PPHA. I'm always going to plug that in there.
Yeah. Absolutely, and thank you for doing that. So,
Yeah.
I really appreciate you coming here or meeting with me and taking your time to do this. Thank you again so much for the information.
Yeah, thank you.
All right, have a great day.
You too.
Bye-bye.